Now, before performing the health assessment, you should ensure that the patient's current medication, immunisation and past history lists are accurate and up to date. And that, we don't really know that at this stage because we haven't necessarily spoken with the patient, but it's warning us that if there's any anomalies, that then the patient would see the GP and make sure that the notes are corrected. To be eligible for the MBS rebate for this health assessment, item 700 or 702, 704, 706, the patient consent must be obtained. So this is where at this stage we would get our patient in, and today I've got Fred here. Mr. Fred Andrews.
Hello.
Come in, please. I'm Lynn. I'm here today. You're here to have your health assessment. Do you know what that's about today?
Not really, no.
You don't know. Now, there have been some practices I've worked in where the patient has been phoned and asked to come in. It's necessary for them to have the health assessment, and they've walked in very aggressively because they don't know. They're quite healthy. They don't know why they've been summoned. So at this point, it's good to be aware that the patients know why they're coming and that they don't feel that it's an insult to their privacy or anything else. And often at this age, patients have the feeling that we're assessing them to see whether they need to be taken out of their home. And the whole idea of the patient 75 years plus health assessment is to put everything in place to allow them to live in their home for as long as possible, and as long as their environment is safe, or we might be able to put things in place to make their environment as safe as possible so that they are able to live as independently as possible for as long as possible. Now, here's where I'm very careful to go through this very deliberately. In some really big practices, you might have 1 or 2 Fred Andrews in your practice, and you've actually logged into the wrong Fred Andrews. So, Fred, I've got your details up here. Could you tell me when you're born, please?
23rd of February 1923.
Okay, and you currently live at 3 Best Street, St Kilda?
I've lived there for 50 years.
Okay, good-o. And obviously we've got a mail there. And your current phone number is 8182 5634.
Yes.
Great. So I know I've got the person that I'm looking in here. Because now, last time we did this health assessment, Fred, you lived in your own home. Is that still the way things are going with you?
Oh, yeah.
Okay, and how's that going? You managing?
Yeah.
Good. I probably would have worked up to, if Fred was a real patient, just some small talk. How was your trip in today? So that we've relaxed a little bit and we've got a bit of a rapport happening. They know that we're not there as a investigator, but we're there to make sure that they're happy and healthy and that they stay that way. Now, it says here that you've had a history of asthma. How are you progressing with that? Okay. When was the last time you had that assessed? And you've got preventative medication?
Yeah, I've got 2 lots.
You know how to take them properly?
Yeah, it helps when I use it.
Okay. But you're not using it regularly?
3 or 4 times a day.
All right. Well, that sounds like we might need to bring you back and get your asthma reviewed and make sure that you're aware of the correct method of taking your medication and what to do if you have an episode that you've got some breathlessness. Manage that a little bit better. Now, in most of the screens, but not all, there's this little tab down the bottom, and I would put in here review of asthma and medication and management. So we'll just keep going. So it's down to the next screen here. Now, Fred, have you ever smoked? So it's we've got to be very careful that this is correct. So he's actually an ex-smoker and currently smoking no a day. Now, alcohol. Okay, alcohol intake. Statistically, patients, if they are heavy drinkers or smokers, usually underestimate. So you sort of play around a little bit. How many drinks would you drink per week, Fred? Yeah. And how many rounds would you have? So we're just seeing if that... So we're getting up to standard drinks when drinking, 3 and more a day, every day of the week. So there's not a lot of room to be putting that, but down to recommendations, you certainly could be adding notes there that the history that you're getting, so that it defines really where you're up to a little bit more than the straight questions would give you. Standard drinks when drinking, so you're looking at 3 or more, 3 to 4. Usually only lets you put the higher limit in, so let's put 4. Has a current advanced health directive. Have you been in and had any plans done or assessments? Now, the depression scale. Some practice nurses know their patients very well and would know whether this is applicable to go through, because there's a lot of questions. So let's just keep in mind the time we've got. We might do assessment. Now, it's very important when you go through these assessments that you do it word for word. If you do alter the words slightly, you are likely to get a different response. And this is a bit of a journey you go on with some of these questions, and if you don't allocate enough time for these, you don't get time for the journeys. It has scored that for us. The score is 5 and it does not indicate significant depression. So okay that, and it'll say here whether we're depressed or not. It'll actually put a tick in there if our score has indicated so. Now, the same thing is for the cognitive skills. You can go through that screen. Now, if they can't answer one of those, you have to deduct a point for everything they do not get right. Now, don't be too kind, because we're doing cognitive study here. Okay, so nutrition, this is where you ask them, do they have breakfast, lunch and dinner? Ask them to describe to you what a normal breakfast, lunch and dinner would be. And here you can start asking, do you have access to fresh fruit and veg? Do you have your 2 fruit, 5 veg a day? And then you make the assessment whether that's an adequate nutrition. And things might come up in the conversation like, I eat at the club, but I'm not happy about preparing lunch, so I wait till I get to the club, or I've got breakfast cereals out of box, but I couldn't be bothered with lunch, so I wait. And those sorts of things, you can make an assessment and make your notes. Now, with your exercise, these days it's considered that 30 minutes most days is adequate exercise. So you can make your assessment. Do you set time aside to have your exercise? And these days too, they're saying it can be in slots of 10 minutes, but you must get to the huffy puffy stage. So as long as it's consistent time set aside, walking around the backyard as a stroll, I wouldn't consider that exercise. Apart from maybe a 92-year-old with a walking stick, you would make notes that that would probably almost be adequate for that situation. Sleep. Do you get to bed at a certain time regularly? Do you sleep well? They might have urinary frequency because of prostate issues or whatever. So you might make notes, is sleep interrupted regularly because of toileting? Whether you wake up at a regular time in the morning, do you wake up as if you've had a good night's sleep? So they're the sorts of questions we'd be asking. And continence. So here's a good time to be saying, can you hold on? Can you wait? Do you have urgency? And also, there's this question that I start to allude to things like, do you have regular bowel habits? But there's also a question through this that asks about abdominal pain, or have you had any more abdominal discomfort? And if you've got allergies, you just revise that with them and go to next. Now, if the patient and your record keeping is accurate, the information in your practice, if they've had their last influenza, their Pneumovax or their last tetanus shot, should automatically drop into that. And that's what we're talking about, data cleansing and accurate data taking when you do take it, because it makes the whole system a lot easier to use as you go through. Now, here's where you do your hemodynamic studies, your blood pressure, your pulse, your weight. Now, hopefully most rooms these days have got patient scales and a height measure on the wall or the door, so that can be done without disturbing other rooms, and you can put those into. Now, also some surgeries have the eye testing charts down the corridors that you could use. Urinalysis, in the letter you've sent them explaining that they needed to come in for this, you ask them to bring a sample of urine. If your room's set up and you know you're doing these clinics, it's good to have the availability of the dipsticks in that vicinity. And in the progress notes, it would actually come up that we'd done the health assessment.